moving forward. As we spoke about earlier today, it is really, in many ways, a brave new world. Very pleased to be joined for a conversation by Raf Souccar, who is with Aleafia Health, Canada's leading medicinal cannabis company. And Raf, we really appreciate your time on the show this morning. Thank you.
Thank you for having me on.
You were actually part of the task force that helped the federal government study legalization. Are we ready for this here in Canada?
You know, I'll answer that question by telling you when I first was given, and I'm going to call it an honor to be part of the marijuana legalization task force, I thought that it was about time. I thought that tightly regulating, restricting, and legalizing it at this point in time was the way to go, and it would certainly go a long way in stopping the criminalization of our youth for something that had been going on for a while, and frankly, something that you just can't arrest your way out of.
So this is something now that we've gotten little glimpses of with respect to its rollout. We know that there will be, for example, here in Ontario Cannabis stores that operate much like LCBO outlets where you can go in and purchase our legal cannabis products. What else do we know about what this looks like here in Canada when it comes to recreational use now of cannabis?
Well, one thing we know is that the product that will ultimately be consumed is going to be product coming from Health Canada licensed producers that are very, very strictly regulated in terms of the cleanliness, if you will, of the product, lack of pesticide, contaminants, and so on and so forth. So at the very least, we know that the product that's going to be sold at the retail outlets is going to be much safer to consume than cannabis being purchased on the black market in an alley from some drug dealer.
Do you think this can or will cut into the black market for cannabis?
I think it definitely will. I'm not suggesting for a second that individuals involved in this business illegally are going to all of a sudden abandon their criminal activities, but they'll certainly migrate to something else. So I do think that the legalization is going to, over time, not right away, because 40 stores certainly is going to continue to provide territory for the black market. But over time, I am convinced that, yes, it will go a long way to eradicating the black market.
Speaking of the business side of things, Raf, you being with Aleafia Health, a medicinal cannabis company, would obviously see a little bit more of this firsthand in terms of those who are using cannabis for medicinal purposes. Will this legalization, do you believe, perhaps reduce the stigma associated with medicinal cannabis?
I think it will certainly reduce the stigma for sure. While I was on the task force, we met with medical users, and frankly, I have to tell you, I was very surprised at the individuals that were medical cannabis users. I wasn't sure what to expect when I first met with them, but walked out of that meeting a very changed person, to the extent that these were people very much like you and I, people who are vice presidents of multinational corporations, mothers of young children that have, one of them that I met, her 9-year-old boy had Dravet syndrome and was on cannabis and had managed to go from over 100 seizures a day to less than 5 and upwards of 2 weeks without a single seizure, was finally able to go to school, go out and play with his friends and have friends. And so absolutely the stigma will happen, but medical users were very clear that they wanted their own regime, because they made clear that they don't use cannabis to get high. They use cannabis to get normal. They use cannabis to stay away from the opioids that have wreaked havoc on our population, that have caused a lot of deaths, and so on and so forth. So with us at Aleafia, we're very vertically integrated. We grow cannabis. We have our own patients. We have over 40,000 patients. We have clinics across the country. And we have physicians. We have trained over 86 physicians. So I think as cannabis becomes more normalized, if you will, so will the medical side of it, where people will begin to understand more the medical benefits of cannabis.
And so as cannabis does become more normalized, and if we look at, to use a reference you just made about those who are looking to use cannabis to get high, to get that buzz, much like many of us would turn to alcohol for a buzz or even more at some points, do you believe we are going to see more widespread use of cannabis now that it's legal?
I really don't think so, Mike. And I don't think people will wake up in the morning and decide that they are going to roll up a joint and smoke it to get high, no more than somebody may decide to wake up in the morning and decide to snort a line of cocaine. I think what's very important here as legalization happens is the education and awareness piece. Things that live in the shadows tend to be ignored. With legalization, it's going to bring cannabis out of the shadows. And I'm very hopeful and very convinced that as the education and awareness spreads and begins to be included in school curriculums, you're going to see more and more youth being more educated on cannabis. And perhaps one day we won't be one of the countries with the largest youth using population in the world. Kids today are more likely to drink and to smoke cannabis and drive than drink and drive. And I think the reason is that we have done a fairly good job educating on alcohol, but we haven't with cannabis. So I'm convinced that with legalization will come more education and awareness.
Given how involved, Raf, you've been in this, from the task force to now, of course, working in the medicinal cannabis industry, I would suspect that you support this legislation that legalizes cannabis and really puts Canada, right up there with the Netherlands, I suppose.
Well, no, and let's not forget, the Netherlands, it's not legal, it's tolerated. In Canada, it's going to be legal, and it's going to be legal coast to coast to coast, unlike in the United States, where it's legal in some states, but federally illegal and not legal in every state. And so you have the interstate transportation of cannabis from one legal state to an illegal state. So what they have is what they call the gray market. In Canada, we're not going to have that problem because I think we're doing it the right way. We're legalizing it as a country. And so you're not going to have the interprovincial movement of cannabis for illegal sales. You won't have that direct tourism that may happen from people coming from one province to the other. So doing it as a country, and this is why I say the eyes of the world are going to be on Canada to see how we do it. So we need to get it done right. We cannot stumble and fall.
Given the recent trade woes dispute between Canada and the United States, does this threaten to strain that in any way, given the fact that we are neighboring nations?
You know, I don't believe it will. I think they're going to be watching us very closely to see how we do it, and they're going to follow in our footsteps at some point down the line. They're already doing it. There are, I think, over 20 states that have legal medical use, and I'm not sure of the numbers now for recreational use. I'm going to venture to say about 10 or so. While I was on the task force, there were 4. So the numbers are increasing, and I think there is more of a signal being sent by government on the U.S. side that they are beginning to tolerate it more. They're beginning to look into it more, and they're not taking as hard a line on it. And that's, again, why it's important for us to get it right, because they'll be watching.
Raf, appreciate your time today. Thank you very much.
Thank you very much, Mike. Have a great day.
You as well. Bye-bye. Raf Souccar. He is with Aleafia Health, Canada's leading medicinal cannabis company. He's